Welcome back, Dave. Welcoming Dave back for a part two. We, of course, did a part one together. I recommend everyone go back and take a peek at. But as you remember, Dave is the founder of Advanced Fundamental Health. He is a holistic health coach that specializes in men's hormone replacement therapy and testosterone replacement therapy. So, welcome back, Dave. Tell me what's been going on since we last met.
Well, thank you so much for having me, Keith, and thank you for having me back again. Since we last met, it hasn't been too long, but what I've been working on is my third book in my series. It's going to be called TRT 102, and it's all the lost chapters of everything that I didn't get to fill in for the first two books. And one section that this book particularly focuses on, which I have a feeling we're going to talk about shortly, is around the importance of looking at mental health regarding men's health as a part of hormone optimization therapy. And one thing that I like to look at is when we talk about TRT, meaning the second T standing for therapy, is that a lot of the time the injections that someone takes or the cream that they apply or the pills that they take is not the entire gamut of the therapy that they need to receive. A lot of the time it's exercise, diet, and sometimes mental health related as well. So I'm writing my third book on that. And we're just coming out of a very dark winter here in Lithuania. So I'm enjoying the spring sunshine that we had today too.
Well, good. Well, good. Well, look, let's get right into that, Dave. I had the pleasure of watching an Instagram feed you just did the other day, and I found it very prolific, and it sends the right message to men. Now, look, we all know we need to get our foundation of health down. We need to, and that involves nutrition, exercise, and of course, hormone optimization. That for me is the trifecta of health. Of course, we need to reduce stress and get adequate sleep. But even when all that's done, remember what we're doing when we're providing men with testosterone replacement therapy or even hormone replacement therapy for these older men and women. What we're doing is we're taking a set of symptoms that we feel may be related to low hormone levels, and we provide them with adequate hormone levels to overcome the symptoms of the deficiency. And after we do that, whatever should be related to that hormone or hormones should improve. But it doesn't always work that way. As I've explained to many men before, there are symptoms that we want hormones to improve, and then there are symptoms that hormones are going to improve, and they're not always the same. Just because you want it to be better on hormones doesn't mean that it's going to get better. And so when we talk about some of these mental health issues, there's many out there, and yes, they've read all over the internet and every forum that, man, testosterone causes depression, testosterone can cause low testosterone cause anxiety and all these issues, but yet they have low testosterone, have anxiety and depression. They have optimal testosterone levels and still have anxiety and depression. So, Dave, which is it? The low, the optimal, or is it not testosterone at all?
Yeah, this is such a good topic. And this is a topic that I inevitably transitioned to doing health coaching because this was the thing that the people needed. Because as I'm sure you've experienced, there are so many guys who have the most perfect lab work that you could possibly get them and the most perfect protocol, but they still have these what they would describe as negative symptoms. And a lot of the time it's related to diet and lifestyle. But the other thing that we also have to take into account is that a lot of the time it's to do with these maladaptive processes that have come and arisen, or just the man turning into the being that responded to the low testosterone and the low hormonal environment that he experienced for many years. And I see this being particularly devastating for the younger guys who never had that optimal testosterone level to begin with. Not only physiologically did they not get this androgen saturation when they're supposed to, but also in their early 20s, they didn't get this sense of wanting to take risks and take on the world with courage and bravery and all of these things that testosterone is so important for. And as a result, they become meek and afraid and maybe involuntarily introverted, not because they prefer their own company, but because they're so afraid of the world around them. And they develop this learned fear mindset. So they come in with this idea that, oh, once I get my testosterone levels up to the optimal masculine level that they should be, then all of a sudden I'm going to become that optimal masculine man. And then when that doesn't happen after 12 weeks, maybe 6 months, maybe a year, depending on the guy, they think, oh, well, I just must need more testosterone to be more masculine and manly. And I have found that that's just not the case. It would be great if that's how it works, but it doesn't.
That's right.
And what's very important that I like to explain to these guys and go, look, if I fix your car, it doesn't make you a better driver. It might make it easier to become a better driver, but you're still going to need to go and learn those skills. But now that we've fixed the car and the car's not malfunctioning, now you can go and learn how to become a better driver, and it's actually going to work. Same with diet, same with lifestyle. It's like if we've fixed the foundation for the house that kept falling down, you still have to go and rebuild the house. And I think the hard thing is that If you've tried therapy and you've tried diet and you've tried exercise and it's failed 10 times because you had a low hormonal environment, it takes a lot of courage and a lot of bravery to go, I'm going to go try this thing again that didn't work before, but this time I know it's going to work. That is so difficult to do, but you have to do it. It's like stretching, it's like eating well, it's like all of these things. It's like they're difficult, but they're doable and you have to do them. And that's the thing that I think is important is that there's this interconnected relationship between the biology and the psychology. And it's much easier for us to come in and fix the biology, but the client or the patient, they've got to go out and do the rest of the work and meet that medicine halfway. And I think that a lot of the time guys are looking for the shortcut, they're looking for the supplement, they're looking for the magic snake oil thing that some guy on YouTube's going to sell them, which is all just a load of crap. And at the end of the day, it's stuff that we say TRT takes time to work. It does, but it also takes time to do the work that needs to be done. And if you're particularly far off track, it's going to take you months, maybe years to get to the point that you really want to get to. And all we can do is lay the foundation for you to do that right.
You're right. It's human nature for all of us to want an easy button, but this is not an easy button for everyone. You know, we can provide the hormones, get levels optimal, and then, as I tell men, you've got that box checked. Whatever's not better, we need to address via other methods. It's just that simple, and it should be that simple. It has nothing to do with not an adequate protocol or need to add, this other supplement to the mix, as you've mentioned. They have to put in the sweat equity, and they have the hard work. These men have the hard work. We have the easy job. They have the hard job. And those that are willing to put in that work and effort and sometimes have the strength to accept that, look, I may need counseling or other avenues. Those are the strong men. It's not the strongest that survive. It's those that best able to adapt. And so you're completely correct. It's not a quick fix. It's an overnight fix. We've talked about this before. It's months and years. That's what we need to be looking into. So that's a very good point. And now that kind of leads us into kind of the different populations that you and I see, and what the goals and the focus is in those different populations. So as everyone knows, I treat middle age and older men. I don't treat men under 30 unless they have true hypogonadism. And there's a couple of reasons for that. It's just that there's so many older men that need it that don't know it. I treat a lot of men with prostate cancer and other issues. So I treat men basically 40 and above. Yes, I have some in their 30s, but for the most part, it's an older age group, 40 and above. And what I do is bioidentical hormone replacement therapy. Now, there's testosterone replacement therapy, which is just testosterone itself, which may be adequate for many men in their teens and 20s, of course. But when you get above 40, it becomes about bioidentical hormone replacement therapy, meaning that we're addressing all the hormones and we're trying to address the age-related decline that occurs in all of us. It's about prevention of age-related disease, disability, dependence, and frailty. It's about never suffering the symptoms of a deficiency. It really is about prevention, but prevention is a hard concept, Dave, because we've all been taught from a very young age. We only go to the doctor. We only go when we're sick, when we feel ill. We don't go when we feel good. We're not taught about prevention. But what this is really about is about prevention. I was listening to a lecture of a very good cancer specialist a year or two ago, and he pointed out that, look, these cancer cells, when you get diagnosed with cancer in your 60s or 70s, it didn't develop last year or even 2 years ago. It started developing decades before. So, what some of these men start doing in their late 30s, basically 40 and above, is going to make a significant impact on their health and well being decades down the road. So, we don't wait for these older men 40 and above to get symptoms of a deficiency. We're preventing the symptoms of the deficiency from ever developing. And that's really what it's about. It's understanding that each and every hormone has beneficial effects, but they work synergistically. Now, that's a little different sometimes, and we don't give contradictory advice. We're on the same page in literally every facet. So it kind of differs in the advice that you give these younger men that are less than 30. So why don't you talk to us about how you kind of approach that age group of men, since that's not my age population that I treat?
Sure, absolutely. I like the way that you look at hormone replacement from just to touch on what you said. And the way that I use the analogy is that again, I'm coming back to cars all the time, but we know that if your car needs a service, if you keep driving it, you're going to make the problem worse. And if you know the wheels are going to fly off, and you know you don't need to wait for a massive crisis to happen before you go to the mechanic, you go earlier to prevent the bill from being huge. But in this case, we're not talking about a bill for your car. We're talking about your health. You only get one body. So I really like this approach of focusing on longevity through hormone optimization, because you're protecting against the diseases of aging, which are basically left to manifest. It leaves the body wide open, which is what we particularly, it's not what we, but it's what the medical industry has been much better at identifying in women in menopause. All their diseases of aging risk goes through the roof. And one thing that we know for sure, well, I would hope most people know for sure, I know that you at Tier 1 do, because your wife treats women.
Mm-hmm.
Yeah.
That's right.
You don't just treat one hormone in menopause, and it's the same with age-related hormone decline in men. It's not just testosterone, just like it's not just progesterone in women. It's all hormones that go down, and where there's smoke, there's fire. So if you're old enough to have low testosterone from age, there is a very good chance, unless you're an outlier, that you have also begun to decline in other hormones. It just wouldn't make sense otherwise. I guess the thing that's different I also treat older men, and I treat older men very similarly to how Dr. Keith Nichols does. But when I treat younger men, it's a little bit different, because they're not dealing with age-related hormone decline. They're dealing with what I believe, well, sometimes it's just poor diet and lifestyle. But a lot of the time we're getting these younger guys who are coming up, who are 21, 22, they're healthy, they're doing everything right to the point that it's almost a bit weird. They're doing
Mm-hmm.
everything perfectly. And they've got lower testosterone levels than you'd see in the average 65 to 70-year-old. And I think this is a result of endocrine disruption, potentially unhealthy parents, exposure to there's so many different things. It's the perfect storm. But I haven't found that those things are impacting the levels of DHEA. Sometimes thyroid, actually. Thyroid's very common. But
Yes.
the adrenal hormones, like pregnenolone and DHEA, I haven't found to be too impacted in these younger men. I mean, when you get these guys come in with these really low levels of testosterone, sometimes they have even above range levels of DHEA naturally, because they're 21. That's where they're meant to be.
Mm-hmm.
But it would be very rare to get to the age of, let's say, 50 years old and have low testosterone and have robust levels of these other hormones. It would be very, very rare. So that's the difference that we're talking about here. And one of the things that I think is a bit of a myth in the space, and this is where people probably think we're going to have a debate and an argument, but in fact, we're just going to agree on it, is that a lot of the time these younger guys think that going on testosterone replacement therapy is causing their low pregnenolone and DHEA levels because they've disrupted this system. And while it does reduce the levels in the testicles or in the ovaries in a woman when we're looking at the knockout of luteinizing hormone activity, the thing that Dr. Keith Nichols has picked up very well, and it's why it's so important. I actually referred a gentleman over to Keith this week who came to me, who was on TRT, but he was in his 60s and the other hormones hadn't been addressed yet.
Mm-hmm.
And I was like, this is exactly what Keith talks about,
Mm-hmm.
is that once you get to that age, the synergy between the hormones is so important. And I like to kind of, when Keith talks about how some of these hormones you feel, some of them you don't, I refer to them a little bit differently, kind of similar. I look at hormones like testosterone, DHEA, and thyroid as accelerators, and things like pregnenolone and melatonin as the brakes. And if you've got a deficiency in your brakes and accelerators, and you come in and crank up one accelerator, you've now created a bigger discrepancy between all these hormones. You've fixed a problem, but now you've created more because you've got further imbalance. And that's why it's so important. But not only just is it important from like a pragmatic standpoint, but from an outcome standpoint. If you take a gentleman who's deficient in all these hormones and you just put testosterone in there, he'll come in and think, oh, testosterone is going to fix all my problems because it sounds cool. It's marketable. It's like selling a thirsty guy a glass of water. Everyone wants more testosterone. But in reality, it's pregnenolone, DHEA, thyroid, melatonin all together that actually do what guys are hoping testosterone will do.
Well said. I tell my middle-aged and older men that, look, when they come in, Dave, as you just made the statement, they're all in on testosterone, all in. Hey, most of them, hey, the more the better, but they're all in on testosterone. And I tell these men that, look, the way you win this mind game, this battle between your ears, is that you need to approach every one of those hormones as you do testosterone. The better the levels, the better the benefits. That's what this is all about. We're trying to obtain optimal levels so that you obtain more benefit from each hormone and at the same time balancing that against any unwanted side effects. And so that's really the point that I get. And men will say, well, I've been told that, I don't need these other hormones, especially if I got normal levels. And they're 40, 50, 60 years old. You realize that the normal levels for 40, 50, and 60-year-old man for like DHEA, for instance, is a lot lower than the normal range for a 22-year-old man that's over 400. So the goal of what we're doing is maintaining these levels as you age in your 40s, 50s, and 60s, just as they were when you were in your 20s. So, in an optimal level. And I'll ask those men, so you're okay with testosterone? Yep, that's what I want. Well, your levels are normal. Why do you want testosterone if your levels are normal? Well, because I've read that it didn't matter if they're normal. I could still have problems. Well, that is correct. You read that correct. But yet you're willing to start testosterone at your age with a normal level, but you're not willing to start any of your other hormones, foundational hormones, because you have normal levels. That doesn't make sense to me. And the reason is because, the two feel good hormones, the two that you can really base on symptomatic improvement, of course, are going to be thyroid and testosterone. I could literally base my adjustments really on clinical symptomatology and improvement. A lot of those other hormones, Dave, like the DHEA, the pregnenolone, the vitamin D3, for instance, look, we really don't notice it when we take it for the most part. Now look, let's make sure we kind of set the ground rules right here real quick. Dave, and I'm going to make a point by asking just a few simple questions. Dave, can you take Tylenol without any problems?
Sorry, what's the generic name for Tylenol? We don't call it Tylenol in Australia.
Acetaminophen.
Can I take it without any problems? Yeah, in the
Me,
short
me,
term, yeah.
me too. Okay, can you take Advil, ibuprofen?
In the short term, yeah.
Yep, yep. And so, so you can literally take certain medications, over the counter medications without any problems at all, right?
Yes.
Now, remember, there's
Absolutely.
going to be people out there that are going to say, I can't take Tylenol. It makes me sick. It gives me a headache. I can't do it. I can't take ibuprofen. It makes me sick. Does this, that, or other. I can't take, Benadryl. Look, when we talk to these men about these hormones, we are talking to the 95.9 or 99.5% of people that can tolerate it. Everybody out there, when they hear a video like you or mine, oh, I can't take DHEA. Oh yeah, when I take DHEA, I know it. That's okay. That's good to know. But the majority of us can't tell it, especially 40 and above, when we take these hormones like vitamin D3. Now, you can know when you're vitamin D3 deficient when it's been a long time. Yes, it can cause fatigue and other issues. But the point is that I'm really trying to make is that we're not speaking to you guys that are those so-called 1% outliers that feel it when you take it or just have all kinds of issues when you take it. The majority of us, and when you look at the studies and older men and women that do take these hormones, they don't have really many problems with it. All right. So the point is that, so these other hormones, since they don't have tremendous feel-good effects, we do try to optimize levels. And that's when we do maybe aim for levels with these other hormones. Whereas testosterone and thyroid, I'm not aiming for a level, I'm treating for symptomatic improvement. So I just wanted to make the distinction there, and that they understand why we do what we do. And so the majority of us can take these without any problems. But if you can't take it, if you can't tolerate it, then either take it in a lower dose or don't take it at all. Let's don't make something that should be very simple more complicated than it is. We're using bioidentical hormones. You are an advocate for, as we all should be, micronized, sustained or loose pharmaceutical grade hormones. They work the best. You've said it over and over again. You've done a great job on all your information. So I just want to make sure that people do understand that that's what we're doing with hormone optimization, especially in my age group. We're preventing age-related decline. We're maximizing levels to maximize benefits. There's a dose-response relationship. That's all it is. Daniel Rouzier, my good friend and colleague, mentor, as he says, he wants on his grave, he wants it to say, what do you want your levels to be? That's all he wants us to say. What do you want your levels to be? So I'll always ask men, these are what the hormones do. What would you want your levels to be? I can make them low so you get low effects of the hormone. I can give you mid-range levels and you can have mid-range effects, or I can give you an optimal level so that you can maximize those benefits of that hormone. Which would you like? Oh, doc, I want to maximize it. So that's kind of our take. That's what hormone optimization is in our world. It's just that. It's not complicated. It shouldn't be complicated. We'll talk about all these other add-ons a lot of other clinics want to do. You send an email to me, like, whether it be HCG and these other things. And so it just doesn't need to be complicated. You've identified just how simple it should be, and it is. It just may not cure everything that man wants to cure. All right, Dave. So look, you are DHEA, Dave. So let's go into, the other hormones and how you like to utilize them and the men that you consult with, everything from DHEA and the benefits that it provides, along with pregnenolone. Okay, those are
Hmm.
all very important hormones. And of course, melatonin, one of both of our favorites.
Hmm.
It just doesn't get enough press. If melatonin got the press it deserved, people would just be begging for it. All right.
Hmm.
So tell us, Dave, let's hear about the supplemental hormones that we utilize along with testosterone and of course thyroid.
Yeah, yeah, absolutely. This is one of my favorite areas, and the thing I love about this area is that you made videos on these topics years ago, maybe like 5 years, 6 years ago, something like that. And the thing that I like so much about those videos is how well they've aged. Like I'm sure that you would just stand by everything you said 5 or 6 years ago because nothing's changed. It's more that people have just worked it out and worked out that this stuff is very important. When it comes to DHEA and pregnenolone in men who have age-related hormone decline, generally the response with them when you follow up at 12 weeks is, how do you feel after taking the pregnenolone and DHEA? About the same, not really any different. Exactly. You don't feel it. If people go, oh yeah, I think I might feel something, this, no, it's like taking a sugar pill. But we know how important these hormones are for, and I like to look at pregnenolone and DHEA like yin and yang.
Mhm.
And they have a lot of yin and yang type of effects in terms of pregnenolone and its conversion to progesterone being calming and acting like the brakes, and DHEA actually sharing a lot of properties to caffeine, interestingly. So it's like I like to describe it as your natural version of Valium and your natural version of caffeine. Both important things not to be deficient in. Now, if I get a 23, 24-year-old come to see me and he's had a traumatic brain injury and he's got undetectable levels of pregnenolone and DHEA and you restore them, he'll feel it like that. And
Absolutely.
it's a very different context when we're talking about brain injuries versus men who are aging. And that's where I think some people can get mixed up and be quite confused about this. And one of the phenomena that I think is present here is that pregnenolone and DHEA, as well as melatonin, don't seem to have a negative feedback loop like testosterone does. So we're topping up levels. We're not wiping them out and replacing them. We're topping them up.
Correct.
Um, and I think that's one of the reasons why I'm so encouraging and trigger happy for these older men to use these, is that you don't have to do injections. We're not, shutting down your natural production. I wish testosterone worked like this, that
I
we
wish
could
it
just
did.
top it up. That'd be fantastic. Um, and it's something where there is so much benefit to be had from a subjective standpoint, because you might not notice what these things are doing, but it's because they're bioidentical hormones. They're working with you, not on you. So if you take a drug that's not part of your operating system, you're going to feel it. But a lot of the time when people go, you know what, I don't really feel the thyroid, I don't think it's doing anything, I'm like, well, stop taking it. And then they go, oh, that's what that was doing. Now,
Correct.
that's why I've felt so energetic lately. But because it doesn't feel like caffeine or a stimulant, because it's part of you, you might not feel it. So I go, look, you might not think these are doing anything. Don't refill your script and see how you go. And then they go, oh, that's what that was doing. Pregnenolone's why I've been sleeping so much better. DHEA is why I don't need 3 cups of coffee. I only need one. There's these things that sometimes people don't notice, and that they're so important and beneficial. And the thing that I like that you taught me in your old videos is the importance of not only using pharmaceutical grade products, but using a good pharmacy to make
Mhm.
sure they're actually good. I have seen so many guys come to me using brands like Life Extension or Jarrow or whatever, and they're taking 50 milligrams of pregnenolone and DHEA, and sometimes their levels go down.
Absolutely.
They don't work, and they come in. Or I have a guy, and yeah, I have guys all the time, and they swap over to the same dose of the pharmaceutical grade, and they go, "Whoa, like okay, this is a different thing altogether."
That's right.
And melatonin is particularly because if you want to get into high dosing, you have to get it compounded out, right?
Absolutely.
But
Absolutely. So what you're
yeah,
saying, and I think it's brilliant, is men, we can't use these hormones as medications. I tell men all
no,
the time when it comes to thyroid, if you're fatigued that we're starting this for, if you're fatigued, brain fog, lack of mental clarity, all these issues that you're having is not related to thyroid. It's not going to get better. If it's due to sleep apnea, lack of sleep, working too hard, we all get tired if we work too much. So the point is that this is not going to prevent you from being tired as a normal human being. We're trying to improve fatigue related to a thyroid deficiency. We can't use thyroid as an amphetamine. And those are the exact words I use. We use amphetamines to wake people up that have, narcolepsy and other issues. So you're dead on point, and I love every second of it. So yes, don't use them as medications. So
mhm,
I mean, I think that's just people need to understand that they can't be utilized that way, and they shouldn't be utilized that way. And
mhm.
and the pharmaceutical grade is absolutely critical. Understand that supplements are not regulated by the FDA. There's no guarantee of purity or potency. You don't know what's in them. The only way to know if you've got a good supplement is either to send it out for independent testing or take it for a period of time and then measure your levels. If they come up appropriately, you got a good supplement. If you don't, okay, then you know what you've got. So we've all been duped
Hmm.
by the supplement industry. That's we've all been taken advantage of by them. So yes, we only use a micronized, sustained release pharmaceutical grade hormone whenever we prescribe hormones concerning DHEA, pregnenolone, melatonin. Of course, those are vitally important.
I have been such a stickler for this recently. And I remember when you first spoke about the importance of micronized sustained release hormones for oral hormones, I was probably like, yeah, maybe that's important, maybe not. I was wrong. And the reason why I was wrong is because when you go out and try, like I work with clinics all over the world now, and it is so hard to find clinics that will do micronized sustained, well, sorry, pharmacies that will make the micronized
That's
sustained
right.
release format. But it's so critically important that it's micronized and sustained released because oral hormones have a half life of minutes and they're not bound to an ester and they'll all hit your liver at once. Whereas when it's micronized, it will skip first pass metabolism and absorb gradually in the gut. And if you can combine that with a sustained release matrix as well, it means that you're getting not only a sustained release into the body in terms of a steady release, but you're getting it to release where it should actually be metabolized properly, not via first pass in the liver. So if you're taking 50 milligrams of pregnenolone from Life Extension or 50 milligrams of sustained released micronized pregnenolone from a good pharmacy, you're taking two completely different
Too
products.
completely. Correct,
Yep.
Dave. You're dead on, man. Just so proud of you. So when we talk about DHEA and these older men, and we've established the fact that you've established the fact, thank God, that you really can't really tell it when you take it. Once again, if we get symptoms of a severe deficiency of one of these hormones, we may feel that, but we may never want to experience that. We want to prevent it. So when you take it, you don't really notice it. But well, doc, well, what can it do for me then? Why am I taking it then if I can't feel it? Well, DHEA, as you know, Dave, and you add into this list, DHEA can stimulate your immune system. It can improve memory and increase energy, as you've pointed out. It has anti cancer properties. It can improve mood and help with depression. It can reduce your cardiovascular risk by decreasing visceral body fat. It can therefore lower hypertension, cholesterol in some people. It can reduce your insulin requirements. It can protect against osteoporosis. It can improve erectile dysfunction. It can protect against, muscle atrophy, and it protects against inflammation. In fact, it's been used to treat lupus, which is an autoimmune disorder. So, look, those are some of the benefits of DHEA. Most of those you don't feel, but you want all those benefits. And the better the levels, the better the benefits. And whatever level you can tolerate, that's your level. I'll go on and say it online because it's, Neil Rousier is the mentor. That look, whenever I'm treating an older man, typically an optimal level will be around 400 to 600. Some men run higher than that. Some men run lower. Nobody's saying you have to be there, but that was what we would consider a good optimal level for a 40-year-old or older man. So please add on to DHEA, Dave.
Yeah, absolutely. Couldn't agree more. And the things that you're talking about there are all the things that are going to prevent against the diseases of aging,
Mhm.
which I typically look at dementia, cancer, obesity, and heart disease. And all of those things are integral for preventing those at the root cause mechanism. Tell you what, it's hard to find someone with a suboptimal DHEA who has an optimal HbA1c.
Mhm.
I haven't seen that.
Right.
But what I have seen is people who are doing everything right and their HbA1c is not where it should be. They put the DHEA in, then gradually over time that number starts to come down. So I think that DHEA is very important, particularly for insulin sensitivity, as well as acting as a neurosteroid. It is extremely neuroprotective, and when your DHEA levels are low, I like to call DHEA the youthfulness hormone. I like to call it responsible for well-being, and both of those things don't objectively mean anything, but it's just a good label to put on it because when you have the opposite of well-being and youthfulness, what happens is you're more brittle, you're more frail, your energy is lower, your immune system's worse, and your brain doesn't work as well. So all of these things are so it's such an easy little thing to take. And this is the thing that we spoke about off air is that when if we list out mechanistically all of the things that pregnenolone, DHEA, melatonin, all these hormones do, and then we look at all of the things that people are trying to achieve with hundreds or even thousands of dollars worth of bloody supplements every month, It's these are these is like it's like you're downloading a whole bunch of stuff for your Windows computer off the internet, and you're missing Microsoft Office. Like these are like I like to call them the Microsoft Office programs, like Word and PowerPoint and
Right,
Excel.
right.
They're part of the operating system. They're the first party applications that are meant to be there to do the things that you're wanting to do. And if you have optimal amounts of these hormones, you don't need to try to take other stuff to try to do that, because your body found your foundation's there. So DHEA. The other thing that DHEA is very important for is sexual sensitivity. One thing that I notice a lot because in terms of what the main things that guys complain about are generally sexual things, and then
Mhm.
energy and performance and sleep. So when DHEA is low, the sensitivity of the penis goes down. So anorgasmia is very common. Losing interest in sexual intimacy is very, very common. And then it creates also intimacy issues with their partner when they're not able to actually achieve an orgasm. So when DHEA is low, I mean, that's something that when you fix, you go, okay, that's better. But all of these other benefits, you know that they're things that are protecting you in the background from the things that are going to become more problematic. You're going to increase your risk for as you get older. So you're completely right. You want to optimize, you want it with these hormones, if you want to take as much of them as you can tolerate. You don't want to take the minimal effective dose. You want to take the amount that you can tolerate to get the most
An
benefits from them.
optimal level,
Yeah.
optimal dose. That is correct. The minimal
Yeah.
effective dose, yes, that'll work for some, but you want
That's
to
for
maximize the
pharmaceuticals.
benefits. That's right.
Yeah.
And that so Dave, from a clinical standpoint, it'd be very frustrating to us clinicians, as it can be frustrating to you as a health coach. Is look, when you see some of these men, they first start out, they'll do everything like they're supposed to. They'll have great DHEA levels, great testosterone, you name it. And then, you'll follow up with them a year or two, maybe three later, and then they'll come in and they'll have all these complaints they didn't have, especially sexual dysfunction and issues like that.
Hmm.
You'll find that those men will maintain their testosterone. They're all in on that. They just are
Hmm.
not going to stop that. You can pry it from their cold dead fingers, but they'll stop everything else and wonder now why they're having problems that they weren't having when they were doing everything else.
Hmm.
It just doesn't, just doesn't correlate with them. They just can't figure it out until it's pointed out to them. Well, wait a minute, your DHEA was 550 and you were doing great. Now it's, 85 and you're not doing so great, but everything else, is okay. But look, why would you do that? And this is what happens when you do. So look, it's about maintaining optimal levels of each. And you've touched on this recently because it is what aging is all about. Aging is insulin resistance. Insulin resistance is aging. That's what leads to all the complications that Dave just mentioned. 80% of age-related diseases are preventable, but they can all be traced back to insulin resistance. What happens to everyone as we age? Every single human being develops insulin resistance. They decrease lean muscle mass, they increase body fat, especially visceral body fat. They become in a pro-inflammatory state. So it's about insulin resistance. So what do these hormones do? What's the real end game? It's preventing or reversing insulin resistance. And they all work together to do that.
Hmm.
So we think it's vitally important at age 40 and above to optimize all your hormones to maximize those benefits. So Dave, melatonin, well, it really is a miracle molecule. Now, everybody knows I take 600 milligrams a night. Melatonin, as Dave has pointed out, does not suppress your own production because it is not regulated by a negative feedback loop. People only associate melatonin for sleep and jet lag. That's not my primary motivation behind melatonin. Melatonin is a very potent antioxidant and free radical scavenger. And its free radicals that damage DNA and lead to cancer. That's why melatonin can be used to treat and prevent cancers like breast, prostate, and colorectal cancer. Also protects your mitochondria. It does so many wonderful things that people just don't know about. But like I said, if they did, it should be front page news every day. So I know you're a big proponent of melatonin. So tell me how you use it in your population of men, Dave, that you're consulting with.
Well, melatonin's just so damn good for you. That's why it's not front page news, right? There's no money to be
Right.
made in it.
That's right.
So melatonin is wonderful. As you said, melatonin is the body's chief antioxidant. And I, for the last 6 months, have been going on a deep dive down. Is it Dr. Russell Reiter? Is that his surname? Um,
Yeah.
there's also a guy, Dr. John Lawrence. I'm probably pronouncing it
Yeah.
wrong,
Yeah.
but
He wrote the Miracle
melatonin
Molecule.
miracle,
Yeah.
yeah,
That's right.
miracle, yeah, yeah. So I've watched all the content. I have gotten myself recently up to 120 milligrams of
Mhm.
melatonin, and I titrated up quite gradually. Well, I not that gradually. I titrated up very gradually to about 20, and then I moved up in greater increments from there. And I think there are a lot of misconceptions around melatonin, particularly the idea that you only want to take it in minimal amounts occasionally if you're changing time zone or whatever. That was on this idea that melatonin has some kind of negative feedback loop like
Right.
testosterone does. That was debunked a decade ago thoroughly.
Hmm.
It's just that a lot of the people on the internet who speak very loudly about things, who are often selling other sleep supplements, by the way, are saying you want to avoid melatonin for all these reasons, but you also want to take a whole bunch of other antioxidant supplements to do the same thing that melatonin does.
Right.
It's ridiculous. So melatonin is fantastic, and I have found it to be particularly fantastic for people who have, well, basically, the more stress the body is under, the more you can benefit from taking melatonin,
Right.
because melatonin is going to support the body being under stress. The thing that I have particularly found melatonin to shine for is intractable chronic inflammatory conditions like autoimmune conditions,
Mhm.
um, particularly endometriosis in women.
Mhm.
I don't really work with women, but the other thing that I found it really useful for is people with spinal issues or physical pain that prevents them from getting comfortable at night and sleeping properly. Two birds, one stone. Um, so melatonin is a profound antioxidant, and a lot of the things that people are looking for antioxidant benefits for, melatonin is wonderful for. We have incredibly high levels when we're children, and that's why children tend to be more protected against these diseases of aging that we see in older populations. But the other thing that we also have to consider is that when they're looking at studies and saying to take 3 to 5 milligrams of
Mhm.
melatonin because that restores natural production of older people who are living in a world that's artificially lit 24/7. That's
That's right.
not optimal melatonin levels.
Right.
So I think that you should take as much, I think every single person should take as much melatonin as they can tolerate. I think a lot of people, there's a couple of theories as to why some people get that groggy morning after effect. One is that they metabolize it slowly and should take it before dinner. The other is they may be having a sort of detox reaction. I think both of those are viable, but I think the best way to do it is just titrate up gradually over time.
Mhm.
Make sure you get morning sun, which you should be doing anyway. And I have only found more benefits have come from taking more melatonin. I do have 2 spinal injuries, which may be why I get so much benefit from it. But every time I take more melatonin, my wife notices that my skin looks better. My wife
Yeah.
notices that I physically look better.
Yeah.
Um, so melatonin's wonderful. I highly recommend. Like when people say, "Oh, I sleep well, so I don't need to take melatonin." No, no,
There you go. There
no,
you
no,
go.
no, no, no. Melatonin is we're looking at it like pregnenolone and DHEA. We're looking
That's
at it
right.
as a antioxidant, protective, health promoting, health restoring agent. It's particularly useful if you're sick. And you want to, even if you sleep great, you could still benefit from taking melatonin. And you want to take as much melatonin as you can tolerate. And you want to take a micronized pharmaceutical grade version of it so that it gradually gets released in the gut, so you don't get a big spike that's just going to throw your body's rhythm out. And yeah, as you know, melatonin, wonderful.
Yes, yes, you're dead on, Dave. So people understand that. Look, the typical dose, as David pointed out, for sleep is typically a low dose that's recommended. But if you start looking at the medical literature, look at some of the meta-analysis that have been done. The anti-cancer effects come in around 20 to 40 milligrams per night. So it's a
Hmm.
much higher dose, and there's no
Hmm.
harm in taking more than that. Once again, people will spend an extraordinary amount of money for antioxidants and all these foods and drinks and supplements. None of them hold a candle to melatonin. None of
Hmm.
them. Remember, hormones are bullets, supplements are BBs. It's just the way that it
Hmm.
is. So I'm yes, as you know, I'm a huge proponent of melatonin. I and now look, when you read the book by John, look, we're not going to take it rectally, okay? We're going to take it orally like the studies do, okay? So
Yeah.
you can't vet every book, and there's some good things in there, but sometimes there's these books, and you have to say, no, where did that really come from? So no, let's don't take melatonin rectally, people. If you read the Miracle Molecule by John, is let's take it orally like they do in the studies. So
Hmm.
that's that's an important fact to point out. All right.
Hmm.
So, you've mentioned, of course, pregnenolone. Now, I'll use it in older men, and it's, to improve memory and help with neuronal repair. And of course, you use it as you state in these younger men that have had brain injuries. So, tell us your feelings on pregnenolone itself. It's to me, if people are like, I don't want to take any hormones. I don't want to take any hormones. I just want to do my testosterone, or I just, I don't have financial. I'm not financially able to do them all, and I said, which ones can I cut out first? I will typically say, well, if you're going to cut out any hormone and not take it at all, I guess it would be pregnenolone on my list. But I'd recommend that you take them all because we've already talked about it working synergistically with all your other hormones. But if Dave and I had to really throw it out there, the data in humans and randomized control trials is somewhat limited in pregnenolone compared to the others. Although there's plenty of studies out there, which I have, it's just not as robust as our
Mm,
other studies. But I do use it to improve memory and help in neuronal repair. How about you?
yeah. Completely. And it's kind of like when people ask that question of like, oh, if you could only do 10 exercises for the rest of your life, what would they be? And I'd say, well, why can I only do 10? If they say, oh, if I could only take 3 hormones, what would it be? It's like, why can't you take 5? Like they're
Exactly.
not, it's not, and especially like, I don't know about you, but I get them, I get like a morning capsule and a night capsule. So I compound them together so that way, we can do whatever we can to make it easier and more economical for people. But yeah, I mean, I guess if I had an older gentleman who was like, what's one hormone I could cut out if for some reason I couldn't, I mean, yeah, I'd probably pregnenolone if I had to, but
Right.
I wouldn't. But yeah, so when it comes to pregnenolone exerts a lot of its effects in the body via conversion to progesterone and allopregnenolone, and these are where it has its calming effect. So it's what's called a GABA A receptor positive allosteric modulator, which is a fancy term for making the GABA A receptor more sensitive, which is the same mechanism of action as benzodiazepines, Valium, Xanax, etc. So when someone is deficient in pregnenolone, what pregnenolone also does in the brain is it is very neuroprotective.
Mhm.
So anytime someone takes anything that's intoxicating, whether it's caffeine or amphetamine or alcohol or whatever it is, the brain increases pregnenolone release to basically prevent your brain from getting too overexcited and going into an oxidative stress state. So it's like a thermostat.
Mhm.
And it seems to have, as well as DHEA, have a lot of these thermostat properties throughout the body. It works on the endocannabinoid system. So a lot of these benefits that we see from cannabis are happening on the CB1 and CB2 receptors, which pregnenolone also binds with. It's technically a
Right.
cannabinoid. So it's got like your own endogenous version of CBD
Right.
almost as
And
well.
that's why you see it being used in all of these substance abuse disorders in the studies.
hmm
Absolutely, Dave.
hmm
Dead on.
And I often find that people who are pregnenolone deficient will self-medicate with CBD because it works on a lot of the same pathways. So pregnenolone is very much, I like to call it the brakes. I do find that when people are deficient in pregnenolone, when you combine pregnenolone and melatonin, they sleep like a baby.
Mhm.
It seems to massively reduce the baseline level of stress in the body, and sometimes this stress can be perceived mentally as anxiety. If you're constantly mentally feeling like there's something wrong, maybe there is, and maybe it's inside, and maybe you're reacting to that. It's like a crying baby.
Right.
It's saying problem, problem, problem. You don't know what it is.
Right.
So when I see younger guys who've got brain injuries when they've got pregnenolone deficiencies, the main thing that you see pop up is anxiety and insomnia and being what I call wired and tired. It's like being full of beans in a bad way.
That's
It's like
right.
having it's like the bad part of having too much caffeine. And the thing that I see, like when I reference this gentleman who I spoke about the other day, who I referred to yourself, is that he had all these symptoms of low testosterone, which is low hormones at the age of 60, and the main thing that didn't improve was the brain fog and the ability to articulate, the ability to actually get the words out that you're wanting to articulate. And I always stutter on this point, ironically, but it's when you're actually trying to articulate what's on your mind and when you're able to speak with good fluidity and speak well and confidently and not stammer over your words or lose your tongue. And I think pregnenolone makes your brain work better. It's a very powerful neurosteroid, and it's very protective against cognitive decline. And it's also like as you mentioned before, insulin resistance is when I said those 4 diseases of aging, they're all
It's
insulin resistance
resistance.
at foundation.
That's right.
Absolutely. And dementia is type 3 diabetes. So I think that when I look mechanistically, pregnenolone and DHEA are very important for energy metabolism in the brain, which you can cognitively feel, but it's also going to be the thing that's going to protect you when you get older. And that's what I think is very important is people want to get to 70, 80 years old. Everyone's talking about longevity. It's like, but you want to actually be doing well when you get there. You don't want to spend the last 20 years of your life, not being able to clean up after yourself. You want to actually be sharp and present and functional. And that's what pregnenolone, DHEA, especially together, are going to be able to facilitate for you. It's just pregnenolone to the brakes, and DHEA is more like the accelerator.
Everyone, please listen to what Dave's saying. I wish they could make a reel on what he just said, which they will, I'm sure. In that, look, you take them now, you optimize them now for what it's going to do for you 30 years from now, not the way
Mhm.
it makes you feel now. Do not get caught up into only the feel good effects. I'm not going to take it if I don't feel it. Understand that what you do now will have a profound effect on you 30 years from now if you will do it daily for the next 30 years.
Mhm.
It is
Mhm.
it's so hard to get people to understand that and do it. They'll start for a while, and then people get complacent and they just stop. And once again, they'll just start looking for an easy button somewhere. But there is not one. There is not one. But for me and you, taking hormones is just so easy. It's as easy as brushing our teeth. It's just as easy. So please, it is about prevention, and do not wait until you get symptoms of a deficiency. Do not wait until you get a disease or disorder to start treating it, because that's how we're trained in medicine. We're trained to treat you once you get the disease. You're trained to go to the doctor once you get sick of the disease. We're trying to prevent you getting that age-related disease. We're trying to prevent insulin resistance. We're trying to reverse insulin resistance. So please listen to everything that Dave just said. So while we touched on some mental aspects of pregnenolone and the others, that'll lead us into thyroid. So thyroid is probably the most controversial one of them all. It's the one that creates ire with the family physician or internist because it is poorly understood, just like testosterone has been for several decades. And I think what men need to understand out there is many men out there that get on testosterone and still have symptoms, fatigue, brain fog, lack of mental clarity, weight gain, inability to lose weight, even erectile dysfunction, things such as that. A lot of times those symptoms are from thyroid. So low acting thyroid in a man looks just like low acting testosterone in many areas. And that's why they don't get better when they just get testosterone in some instances, because the clinic is throwing testosterone, which is actually also a thyroid problem. So that's why, but what I found, Dave, in my practice is I used to teach about thyroid right off the bat, about optimizing levels in men. Understand that thyroid regulates temperature, metabolism, cerebral function, and energy levels. It protects you against cardiovascular disease, cognitive impairment, fatigue, weight gain, memory loss, decreases visceral body fat, and improves your lipids profiles. The better the levels, just like with testosterone, the better the benefits. So I used to preach to the men that all the wonderful benefits of having optimal levels of thyroid, just like having optimal levels of testosterone. They can always understand testosterone, but inevitably they would call back a month or two later. Many of them, why am I taking this thyroid again? I don't want to take it anymore. I just want to take my testosterone. Then they'll stop and they'll start feeling bad or whatever. And maybe they won't start feeling bad, but the point is then their thyroid labs are not optimal anymore, because that's what hormone optimization is about, is maintaining optimal levels. And so what I have found that works recently best with men is men tend to typically do, most of them, not all of them, some of them understand hormone optimization after 40. But what I found, Dave, is that it works best in them as far as them accepting it and understanding it. If I start it after I start testosterone and the other hormones, get everything optimal, give it time to work, and then if they have symptoms left over, still have persistent fatigue, brain fog, lack of then they'll start thyroid, and they tend to do much better when they know exactly the symptoms they're starting it for versus starting it and optimizing the levels and not waiting till you get symptoms of a deficiency. So if in a perfect world, if I went back to age 40, I would start all my hormones. Whether I had symptoms or not, I would start all my hormones. I maintain I had optimal levels. I would never want them to be anything but optimal. And that's Neil Rizier's perfect world too. And so that would be our perfect world, but we don't live in that perfect world. So that's kind of my approach to thyroid. It's a vitally important hormone. The two feel-good hormones are testosterone and thyroid predominantly, and those are the ones that have the greatest impact on how you feel, function, perform, and your overall health on a daily basis, are those two. Those are the biggies. And so, Dave, you can tell us how you approach, consulting men on thyroid, but that's kind of the approach that I've taken after doing that for so long, is I tend to get everything optimal first and then add thyroid. I kind of put it on deck for them, unless they want to start it off bad. They're given the opportunity, as every man is, just like with testosterone. They can not do it, optimize it from the beginning, or just wait and start it later. There's no wrong answer for that man. Whatever his answer is his answer. Okay. So tell us how you approach that in your practice.
Okay. Yeah. So thyroid's a big one. Thyroid is also common in younger guys as well. Again, I don't know what it is. Sometimes it's Hashimoto's, which is autoimmune. I think there's also an endocrine disruption that plays into that too. I'm
Military
not
men
sure.
especially bad. Oh, go ahead.
The thing that I've also found is it's really rampant in the UK. Maybe it's something to do with the pollution, weather, I don't know, but very rampant over there. So yeah, if you take a list, if we imagine a Venn diagram that crosses over in the middle, and you've got low testosterone symptoms on the side, and you've got thyroid symptoms on one side, they're all in the middle. They're the same. They're
They
the
are the same.
same.
They are the
They're
same,
the
guys. If you
same.
understand that, they're the
They're
same.
the same. And this idea that if you have to have like cold extremities to be hypothyroid, that's nonsense.
That's true.
That's nonsense. It's I believe that that maybe came from the fact that women run a little bit lower in temperature than men, so maybe that's the first symptom they notice. But no,
They always
so
have to describe the extremes. The extreme of
extremes,
true hypothyroidism. We're not talking about subclinical hypothyroidism or men
yeah,
with suboptimal thyroid levels. We're talking about those true hypothyroid and hyperthyroid. So yeah, that's where that kind of comes
yeah,
from.
yeah. So when it comes to the thyroid, and you've said this before, like when you draw a line in the sand, let's say hypothetically a free testosterone level of 50, and if you're still wanting to throw more testosterone at it, the chances are there's something else going on, and the chances are if it's clinical hypogonadism symptoms with optimal testosterone levels, it's thyroid, but that should have already been checked and taken care of. But a lot of the time, it's not when they come to people like us
That's
because it
right.
gets overlooked all the time.
And they're afraid of it. The
They're afraid of
practitioners
it.
are afraid of it. That's right. That's right.
They're afraid of it and they don't know how to do it. And there are so many men walking around with either undiagnosed hypothyroidism or damn hypothyroidism and they're on T4 monotherapy. T4 monotherapy is like Testogel or pellets. It's crap. It's almost as good as nothing. The thing that breaks my heart is when guys say, "Oh, I had my thyroid removed and now I'm on 100 micrograms of T4 and I'm obese." It's like, well, you didn't have much of a chance.
No,
So thyroid optimization gets a bad rap because a lot of the time people get put on T4 monotherapy, which is useless or it can make problems worse. And yes, there are outliers that do great with T4
that's right. That's
monotherapy.
right.
But the vast majority of people need T3 and T4, and natural desiccated thyroid just works better. I used to think, and I was wrong, and I will eat my words on this. Um, this is another one of those you can say "I told you so" moments because 100% true. Is T3 T4? If you have the equivalent dose of NDT as synthetic T3 T4, it doesn't work as well as the NDT does.
That's right.
Um, 1 in 10 people won't tolerate NDT for some weird reason, but the vast majority of people do much better on NDT. I've had guys be on the equivalent, like let's say a 2 grain equivalent dose of T3 T4, and they swap to NDT, and it blows the levels through the roof. Like
Mhm.
it's a much better medication. So yeah, when it comes to thyroid, I like to think of thyroid as putting the wind in the sails of TRT. Thyroid is responsible for your metabolism. It's
Mhm.
your engine. I talk about thyroid being the furnace that sits in your torso. And when thyroid function is low, it's like when people go, "Oh, I've just got a slow metabolism." You've got hypothyroidism.
Mhm.
Or when you see those, like I used to know people when I was young who would just eat everything and they'd stay
Right.
stick thin. I've recently run their lab work and they've naturally got a TSH of like 0.4 and a free T3 above the reference range. They're
That's
just
right.
those outliers.
That's right.
So you want to have optimal thyroid function, one, because food is wonderful and being able to eat more nutritious food is wonderful for you.
Mhm.
The more good quality, emphasis on good quality, the more good quality food you put into your body, the more nutrients that you can assimilate and the more powerful of a vessel you can build. It's like basically it's like being a more powerful car and going faster. It feels better to be alive when you've got good thyroid function. When you're low in thyroid, everything feels like too much effort and the body constantly has to kick into adrenal hormones, cortisol and adrenaline, to get things done, like a dirty backup fuel source, because your body has to kick into fight or flight just to do basic day-to-day stuff. Thyroid is not amphetamine, like you said before. Thyroid's not like you're sitting down and being like, "Oh, I just want to go take on the world now."
Right.
But what people do notice when they put the thyroid in is they go, "Oh, now doing that cardio and abs at the end of my workout, it doesn't feel like a chore anymore. I
Mhm.
kind of look forward to it. Now I kind of want to go to the gym for as long as I can rather than leave as early as possible. Now, all of a sudden, when I go for a walk, it doesn't feel, I'm not always checking to make sure I've been going for long enough. I just want to keep going because it feels good to move and be alive."
That's right.
And I like to say to people that, again, going back to the car thing, if you were a car that had an engine that's too small for the vehicle, which is what hypothyroidism is, you can still go down to the shops to get milk and bread. You can still get from A to B, but it's going to feel terrible to drive.
Right.
But if you've got a sports car with a souped up engine and it feels really good to drive it, not only is that experience going to be better, but you're more likely going to go for a joyride. So in your spare time, you're more likely going to go and exercise and get off the couch and actually go and do the things that you need to do to achieve your goals. And that's what I love about thyroid so much. It's that it's giving people the energy that they need to put the testosterone and the other hormones to use.
That's right.
And and the other thing that we haven't spoken about this before. I recently did a lecture on, I maybe this term exists. I coined it subclinical Hashimoto's. And this is where people have got elevated Hashimoto's enzymes that are not above range, but they've got symptoms of hypothyroidism, even when their thyroid panel looks okay.
Mhm.
And these people benefit immensely. And these are often the guys who are they're incomplete from their TRT alone, and they're 25, 26 years old, and they benefit from just boosting the thyroid up. Even if it's only 30 to 60 milligrams of NDT,
Mhm.
they do wonderfully with it. So it's so important that people, even if you're just going into this and you're wanting to look at your hormones, get a comprehensive thyroid panel and look at your symptoms, and don't overlook it and go, oh, I've got a little bit of Hashimoto's now, but let's wait until I put on another 20 kilos of body fat and become insulin resistant before I fix the hypothyroidism. It's nonsense. As we said before, the wheels are going to fly off, so service it now.
Or even better yet, Dave, I only need testosterone because my testosterone levels are normal, but they're not optimal. They're on the low normal, and my thyroids are totally normal. They're normal. They're But your thyroid is no more optimal than your testosterone. In fact, when you really look at it, your free T3 is almost tanked. It looks worse than your testosterone does. Once again, men can buy into testosterone and start it with normal levels and realize that, hey, I can still be symptomatic with normal levels of testosterone and benefit from testosterone. They have a hard time applying that to thyroid.
Mm-hmm.
Okay. And so when
Mm-hmm.
Dave mentions NDT, he's talking about natural desiccated thyroid. And when we talk about T4, only that's a synthetic T4 and it's T4 only. Desiccated thyroid is a mixture of T3 and T4. It's 38 micrograms of T4 to 9 micrograms of T3. So you're getting both. The problem with taking T4 by itself for many people, as Dave has alluded to, is that T4 is not the active component of thyroid. It's free T3. T4 has to be converted at the cellular level to exert the benefits of thyroid. And for those people that take T4, you're going to kind of decrease your own thyroid's production of T3 and T4. Thyroid produces, just for lack of argument's sake, 75% T4, 25% T3. So your thyroid typically is going to produce both, but 75% T4, 25% T3. When you take T4 by itself, you're going to shut down that production of T3. Okay. And what will happen if you're not converting your T4 adequately at the cellular level, you may feel worse because now you have no T3 and you're not converting adequately. When we take desiccated thyroid, we're taking both T4 and T3. So, we're getting our T4 to be converted, and we're also getting our T3 along with it so that we're never kind of devoid of T3. So those are the difference between those two. The problem that the family physician has with it is that when they see us raise thyroid levels, when you take thyroid, what's going to happen is when you look at your thyroid panel, there's something called a TSH, thyroid stimulating hormone. That's basically your little thermostat. The bigger that number, that's your body saying, I need more thyroid. The lower that number is your body saying, I don't need to produce any. I do not need to tell my body to produce any more thyroid because I've got enough.
Mm-hmm.
Free T3 will go up when you take desiccated thyroid. Now, when you take T4, that may not always happen, as Dave's alluded to, but that's the goal, is to increase free T3. That's really what we're looking at. So when you take it, what's going to happen to your labs when you take thyroid is when somebody just looks at those labs, they're going to think you're hyperthyroid. It makes you look like you've got hyperthyroidism. Now, hyperthyroidism is Graves' disease. At baseline, they have a low TSH, they have a high free T3, high T4, so they have a lot of thyroid hormone. But here's the issue. Graves' disease is an autoimmune disease. Has an autoimmune component that does the damage. Yes, it causes cardiac abnormalities like AFib and other issues, but the literature is very clear on this. Taking thyroid in somebody that is hypothyroid or has subclinically Hashimoto's or subclinical hypothyroidism, when they take thyroid and their labs move, as we said, TSH goes down, T3 goes up, it does not cause the same sequela as having Graves' disease or hyperthyroidism. It does not cause those adverse effects because there's no autoimmune component. And there's plenty of data out there to show you that. There's some great papers written by Tomas Kelly on this very topic. And so he's even written a book on it. So I'd recommend that, but the family doctors, I was taught that when you take thyroid, you're going to cause somebody to be hyperthyroid. Now, when you take thyroid, yes. Is it going to increase your heart rate a little bit? Yeah. Is it going to make you feel warmer? Dave's already alluded to that. It increases thermogenesis. It increases your metabolism. Yes, you're going to feel warmer. Yes, it's going to increase your heart rate. There's no harm in that whatsoever. But if you're one of those individuals that's extremely sensitive to it, and you feel like you have an excessive heart rate, or feel like you're having palpitations, or you're having excessive sweating or heat intolerance, you can simply just lower your dose to resolve those symptoms. Once again, it's always a balancing act between raising levels to resolve symptoms and avoiding any unwanted side effects. And sometimes it's just lowering the dose and finding that midway point for you. So anything you want to add to that there, Dave?
Exactly what you said about the TSH being a signal for the body wanting more thyroid. So I like to use the analogy. Usually I have a glass in front of me, but now I've just got the bottle. So it's kind of like if you're in a restaurant. Basically, the glass of water you have is like the T3, and then this bottle is you signaling to the waiter to say, "Hey, give me more water." That's the TSH. So what you want is you want a full glass, and you want you to shut up, and that means that TSH is generally under 1, close to 0.5, if not lower,
Mhm.
under 1. And people think, oh, that's great. No, when you see people who are 23, 24, who are athletes with optimal thyroid function, they generally have a TSH of like 0.4, 0.5, and they have a T3 often above the reference range. And I tell them, I go, this is rare, this is optimal, and this is what we aim for with hormone replacement. Now, you find me a 50-year-old who's got a natural thyroid panel looking like that, and I tell you found Bigfoot. They don't exist. It would, and especially if they have low testosterone as well, be very unlikely. So when it comes to the thyroid, if that TSH is elevated to varying degrees, your body is signaling that it wants more T3 at the receptor level.
Mhm.
And the problem is that there's a whole bunch of chronic inflammatory conditions, such as insulin resistance, which is this vicious cycle, right?
Right.
Because insulin resistance reduces thyroid function, which slows your metabolism, which makes it worse. The body gets stuck in these vicious cycles, and this is where this interventional, hormone replacement therapy can break these vicious cycles so that people can get their health back, which is why it's such a cool topic. But if your body is signaling that it needs more it needs more T3 at the receptor level, that means that your metabolism is suboptimal. And if your metabolism is suboptimal, it feels better to have an optimal metabolism. You have more energy to do the things that you need to do to look after yourself better. People make bad decisions when they're stressed because they go for the easy path. So that the vast majority of people, even the vast majority of guys under 30, maybe not so much, maybe if we're talking over 50, it would be 99% of guys would benefit from thyroid. In terms of under 30, I would still say 60 to 70% of guys would benefit from at least some thyroid. You do see the optimal guys every now and then, but you see a couple of them a week. The vast
Right.
majority of younger guys, you see a bit of an elevation in
Right.
TSH, and it just might mean that they could benefit from a little bit of thyroid. But the cool thing about thyroid, which you've spoken about before, is that yes, this TSH feedback loop is active, but we've got a lot of research to show that people can withdraw thyroid medication after years, and their natural production comes right back.
Comes right
So
back. You'd die if it didn't. I mean, basically.
yeah,
Yeah.
yeah,
Yeah.
exactly.
Yeah.
And that's the other thing as well when it comes to this Graves and the hyperthyroid thing, is that like, yeah, so when someone has Graves' disease, it's got that autoimmune component. It just means that the waiter's there just pouring that water nonstop. That feedback loop is gone.
Right.
And that's why it's so dangerous. If you take a little bit too much thyroid, your body's natural production will just compensate by lowering. But I don't know about you, but I have never found that someone continues to take medication that makes them hyperthyroid. It's like coffee. There's a certain amount of coffee that you drink in a day and you go, I'm not going to have any more. If your dose of thyroid is too high, you'll stop taking it before you end up in hospital.
Exactly. Well, you've given out a lot of pearls of wisdom. Let's back up to some really excellent point that you made. Is that look, these young athletes that have beautiful thyroid panels, everyone needs to understand that our normal range for thyroid is not for a group of healthy people. It's the average of the population that you see around you. A lot of times it's made from a captive population, such as those in hospitals or clinics. So the point is that when a man says, well, look, my free T3 is normal, it's 2.6. Well, the normal range is 2.2 to 4.4 in some labs, and I'm like, but okay, it's 2.6, which is at the bottom of the normal range for a group of sick people. Is that where you really want to be? So if Dave and I were to be able to take these athletes that he's speaking of and just get our normal ranges from them, it would be a much different normal range. And that's
Hmm.
what people need to understand. They people don't want doctors paying attention to labs and normal, but they themselves can't break away from looking at labs themselves, if you know what I mean. It's kind of a catch-22 for them. They'll once again, they can understand testosterone to some degree, but when it comes to the other hormones, they just can't seem to make that next step to understand that it's just like treating testosterone. And when we're treating thyroid, it's just like testosterone. We're treating really free testosterone levels, and for thyroid, it's about those free T3 levels. And yes, a suppressed TSH has never caused harm. It's the free
Nope.
T3 level that correlates best with clinical improvement, not TSH level. My TSH, for instance, Dave, last time it was tested is 0.007. And
Hmm.
you'll see many people with a suppressed TSH, they feel great, they feel wonderful. So the takeaways here is the normal range is not for healthy people. You know, if we got them from the athletes, like Dave said, we'd have a much different range. And that's the key there. And following free T3 and the fact that taking thyroid will not cause you to have hyperthyroidism or Graves' disease. Okay. You can have symptoms of too much, just like you can with testosterone. You lower the dose.
Mm.
Remember, I try to point this out to people all the time. Thyroid's been used for over 100 years. I think the first use of it was in the UK around 1891. They used desiccated thyroid. There were no thyroid labs up until the 1970s, just like there were no testosterone labs until the 1970s. And testosterone was first used in 1935, the mid 1930s. So for decades upon decades upon decades, we have been treating men with testosterone and thyroid with no labs, and it
Hmm.
caused no harm.
Hmm.
Think about that for a minute. They literally treated their symptoms. If they had symptoms of too much, they lowered the dose. Symptoms of little, they raised the dose. That was a better way to treat. Now, clinicians for efficiency will just look at a piece of paper and literally ignore the symptoms or give you a medication for those symptoms and say you don't need it because your levels are normal. Nothing could be further from the truth with hormones. That's not how hormones work.
Oh, I couldn't agree more. And you'll get a kick out of this. So in Australia, if you and we talk about the importance of, so in Australia we have something called like Medicare, which is like the government subsidized health
Mhm.
program. So if you as a doctor order a thyroid panel for TSH, T3, and T4, right, and you specify that you want that, if TSH comes back below 4.5, they won't run T3, T4. They'll say no, your thyroid's normal,
Yep.
and that it drives me up. One, we just get it all done privately because it's not expensive, and you have to get private care these days to get good care. But the amount of people who are walking into their doctor's office with hypothyroid symptoms, who are getting diagnosed with chronic fatigue syndrome, adrenal fatigue, or just depression and anxiety would be astronomical. And it's just going undetected. Or even when the doctor does get a subclinical hypothyroid
Right.
lab back that's obviously that, they'll go, oh, it's within range. You're just depressed. Here's your SSRI, and
That's right. That's
it's
exactly
very
how it
sad.
works. That's exactly how it works. And people need to understand, why has it become so lab centric? Because in order to really treat people like we do, you have to sit down with them and you talk to them, and it's going to take longer than 6 or 10 minutes, which is the average follow-up time in America for a family doctor to see someone. It's just more efficient for them to look at a piece of paper, see that it's normal, tell you they don't need it, and then just go write a script for the symptoms that you're having. It's just
Hmm.
the way the medical system is set up. Okay. It's not optimal in any way, shape, or form. We all know that. I never would believe I'd be talking about this, 20 years ago when I was a good little soldier in that system, but now I understand the shortcomings. So,
Mm.
Dave, I mean, we've talked on a lot of topics today. I know I've kept you for over your hour there, but look, I think it'd be important that, there's a couple of other topics that you and I should get
Mm.
together again and talk with. It would require 30 minutes to an hour, just it alone. And we both know that we do need to touch on estradiol and DHT. I would refer everyone to Dave's book online regarding estradiol and DHT. I would go to his Instagram feeds as well, which have been very good. He's done some really good ones on estradiol recently as well. He was on TRT and hormone optimization recently on estradiol. Everything's spot on. Okay. And so I think it would be nice if Dave and I could get back together for a part three and just really take a little deeper dive into the estradiol and the DHT world. Okay. That's the most controversial world. We understand it. But I think that if he and I could do that, it would be a great service to most people. But Dave, I can't compliment you enough about uh, the knowledge that you have just obtained over the last couple of years, and the. I wish I had time to put out the work that you do on social media, but I just don't have have that amount of time. But I'm so glad that there are men like you out there that are putting out good quality. And the most important word I could use, the biggest compliment I could ever give you, is evidence-based literature. I can't disagree, would never argue with any point that you've made and anything that I've seen in the last year or two. So keep doing the good work. If people want to work with you, how do they get in touch with Dave Lee?
Yeah, absolutely. Thank you. So yeah, that means the world coming from you, Keith. Thank you. And all the video content that I make is very much inspired by the content that you've made. And I even made a comment the other day. I did like a reaction video to your cream video that you just did with Stevens, just to kind of add my thoughts to it. And the point that I made in that I'll make now is that, like, the videos that you put up that are 20, 30 minutes long, they take me 2 hours to break down because there's so much value provided in them. But there's no one else online other than yourself and maybe me following in these footsteps who's just getting online and just educating people to go, this is how you do it. This is the secret sauce. This is how it's done. Because we're actually wanting more people to get better and get this
Right.
treatment properly, because there's so much potential for this to be done right. And it's getting bastardized and ruined
It is.
all over the world in these clinics who are just doing it wrong. So
It is.
yeah, I all the content that I'm putting up is very much inspired by the content that you made, which has just been so educational and well explained, like all those old videos you did with Steven's channel as well as Jay's channel. So yeah, that means a lot. Thank you very much. The way people can get in touch with me, so my website is advancedfundamentalhealth.com. I do health coaching consults. I also have a partnered clinic in Australia. So if anyone is listening and wants, these kind of protocols, we can do similar protocols in Australia as well, finally. So I'm available on there for consultations. I've also written 2 ebooks, TRT 101 and Beyond TRT, which Keith referenced before. And I've also got a number of the lectures that I mentioned previously on the TRT and hormone optimization channel. And I've covered a bunch of these topics and many more.
Well, excellent, Dave. Well, look, you need to get on the TRT and optimization channel. The one just came out yesterday. That's probably the most controversial one of all, which is super physiologic. And I would love for you to be able to view that. And then I would love to get back together with you so we can discuss the details of that video and super physiologic, along with DHT and estradiol. In fact, you need to watch that video and look at the comments, because there's an Australian guy on there. He needs some help. He needs some help.
Okay,
All right. He
I'll check
does.
it
He
out.
needs some help. He needs some help. So, man, I really appreciate you taking the time once again. A big fan. That's, the biggest compliment I can give you. And so thank you so much for what you're doing for this sphere. Okay. And I appreciate that very much. And so I look forward to working with you again. So
thank you very much. I'd been looking forward to having a conversation with you about pregnenolone and DHEA for about 5 years.
So
So
there
I'm
you
very
go,
glad
man.
we got to have
You're the man. You're the DHEA Dave and Pregnenolone man. There you go, man. You've really done a great job with it. I really appreciate it.